There's these different factors that come into play. They cause the ROS in the mitochondria, damage the mitochondria. They're not performing as well. How does that link to mental illness?
So at the end of the day, all of the cells in our body require the appropriate amount of energy and appropriate regulation of their function. So energy and regulation of function, whether it's a muscle cell that's contracting or whether it's a brain cell that's supposed to be firing and helping us remember something, or a different brain cell that helps us move our arm, or a different brain cell that triggers an emotion. At the end of the day, all of those cells depend on energy and mitochondria to regulate what they are supposed to be doing. And when mitochondria become dysfunctional or dysregulated, it means that the cells in our brain and body can become dysfunctional or dysregulated. And that can result in symptoms that we might call mental illness. It can also result in symptoms that we might call neurological disorders, like Parkinson's disease or Alzheimer's disease or seizures. But when other brain regions are impacted, maybe to a lesser extent, it can result in crippling depression or panic attacks or auditory hallucinations or delusions.
One thing that's really interesting when it comes to the brain versus the rest of the body is that the brain can't use fatty acids, or at least not to a great extent, as an energy source. So when we start to have metabolic complications and we can't use glucose as a fuel as efficiently, unlike the rest of the body, the brain can't use the fatty acids to fuel.
But it can use something derived from those fatty acids called ketones.
Exactly. Talk about that piece.
So the body actually has this really kind of elaborate and sophisticated rescue fuel system in place. And it was really probably the obvious reason for it. Like when it comes to like why do our bodies do this? Like we're really just guessing. But you look at evolution or you look at like survival and try to figure it out and try to piece it together and try to at least make sense of it. So that's what I'm doing right now is I'm just trying to piece together like how does this work or why would this happen or why would our bodies even have this feature? The most obvious reason for this feature is drought or famine. So when we go without food, we need a rescue fuel source. And that means we need to start tapping into fat stores. And if we don't have fat stores, we need to start making other fuel sources. And we can actually make glucose from our muscle. But one of the primary parts of this rescue fuel system are these ketones. And this happens primarily in our liver. So when you are fasting or starving or on a fasting mimicking diet, also known as like a ketogenic diet, and there are other kinds of fasting mimicking diets, but when you're in any of those states, your liver actually starts taking fatty acids and mobilizing them. So your whole body, your adipose cells, your fat cells are actually starting to release. Like it's this whole orchestrated event. And it really is about survival. Your whole body is all of the cells and tissues in your body are like, okay, let's go. Let's try to save this person. We're not going to die yet. We're not going to die yet. Even if we don't have food, we know how to do this. We know how to survive. So your fat cells will say, okay, we're ready. We're going to start releasing some fat. The liver cells will take that fat and break some of it up and release it as fatty acids, which can be used by muscle tissue and some other organs. But as you said, fatty acids have trouble getting into the brain. So what the liver is also doing is creating these molecules from those fatty acids called ketone bodies. And ketone bodies can cross the blood-brain barrier and then fuel neurons. And ketone bodies are the rescue fuel source. When our bodies can't use glucose efficiently, or when glucose levels are too low, then your body actually creates ketone bodies to try to save the day, to keep the brain running on some type of a fuel source. And those ketones end up having tremendous, it gets super complicated, but it's more that they are so much more than just a rescue fuel source. They're doing all sorts of things to help heal the body and to help the organism adapt to adversity.
Well, let's connect them to the mitochondria, which has been a big part of our conversation to this point. How do they go about using ketones?
Fascinatingly, ketones begin in mitochondria. Mitochondria are actually in the liver. So the mitochondria in your liver cells are the ones taking these fatty acids and turning them into ketones. So it's mitochondria in the liver that are producing these ketone bodies. And then the ketone bodies travel up to the brain. And what is their destination in the brain cells? It is mitochondria in the brain cells. That is the destination. So it's actually ketones, if you want to think about them this way, they are a signal from mitochondria in one type of cell to mitochondria in another cell. Um, and what they do at the mitochondria and the other cell, so the primary thing that most people focus on is they are a fuel source. So when glucose has trouble getting into the cell, or if your mitochondria are dysfunctional and have trouble using glucose effectively, magically, somehow or another, I think for these evolutionary adaptive reasons, they can oftentimes use ketones as a fuel source, even when they had trouble using glucose as a fuel source. And so the way I think about it is that in a maladaptive state, these brain cells begin to struggle, and they may only have 80%, 70% of the ATP that they actually need to be running on all cylinders. So this cell is now becoming compromised. It's not dead. It's on its path toward death if something doesn't change. And the body senses this. When that happens, that cell starts sending out distress signals. And those distress signals actually cause inflammation and all sorts of other things to happen. That cell is distressed and it is crying out for help, so to speak. It's sending signals that are crying out for help. And again, lots of things begin to happen, but one of the things is those signals make it somehow to the liver and tell the liver mitochondria, hey, yo, we need we need a rescue fuel source up here right away. Like send it now. We're struggling. And so the ketones go up, they get into that cell. The mitochondria can use those ketones to produce ATP, and now the cell starts coming back online and functioning properly again.
Let's bring insulin resistance into this. And this fits into everything we've been talking about. We're just bringing it in and addressing the elephant in the room. Basically, what we've been talking about to this point is damage to the mitochondria. But let's take it from the aspect now of increased blood glucose over time, increased insulin, somebody becoming insulin resistant on their way to diabetes. And then over time, the brain not taking in the glucose. So you have the broken mitochondria, and then you can also have insulin resistance where those cells in the brain aren't taking the glucose in because of a signaling problem with insulin in the brain.
So interestingly, that story gets even more complicated than what you just said, unfortunately. So unbeknownst to a lot of people, insulin plays a profound role in brain function. but it's actually not the same role that it plays in the rest of the body. So usually in the rest of the body, insulin um, attaches to an insulin receptor, and then that allows glucose to flow into the cell. And a lot of people think about it as like a lock and key. Like the insulin receptor is like the lock, insulin is like the key. You unlock it, and then the door opens up and allows some glucose to go in. And that's kind of what happens in muscle cells and other cells, liver cells, and lots of other cells. In the brain, it's actually somewhat different. The most brain cells don't actually require insulin to allow glucose to get in. However, insulin is still critical to their function, and it appears to be mostly critical to mitochondrial function. So the way to think about insulin in the brain is probably more, it's like a neurotransmitter or a metabolic kind of hormone in the brain. But nonetheless, the bottom line is insulin resistance in the brain still results in mitochondria not being able to use glucose effectively as a fuel source. That's the bottom line. That when you have insulin resistance in the brain, or when you have impaired insulin signaling, that's what some of the scientists will say it is, that whatever you want to call it, when that happens, brain cells have less ATP. That's the bottom line. Brain cells will have less ATP because they are unable to effectively use glucose. And so ketones in that situation can also come to save the day. So if your brain cells are struggling, they don't have enough ATP, they're not using glucose effectively for some reason, maybe because of the insulin problem, ketones can still begin to rescue some of those cells and help them function more normally.
Okay, just so I'm clear. So the lock and key, the way I explained it, is how insulin and glucose work in the rest of the body. In the
Yes.
brain, differently though.
Yes.
But insulin's still important for metabolism in the cell and to the mitochondria.
100%. Everything you just said was spot on.
Okay. Because the way I understood it from a previous guest, Dr. Mary Newport, who was just recently on, that the blood brain barrier and the cell in the brain required that lock and key mechanism to get glucose in. There was those two different barriers that could prevent it from metabolizing that fuel.
The blood-brain barrier, that is somewhat true. That the blood-brain barrier does only allow a certain amount of glucose in, but once you get to neurons, for the most part, my understanding, and I could be wrong, I'm open to being corrected, but my understanding is that neurons, for the most part, even neurons that are very sensitive to insulin and dependent on insulin action, most neurons do not require insulin to actually allow glucose to get in, for the glucose transporters to allow glucose into the cell. And the way that I think about that is that neurons are special. There is no doubt. Neurons are very special. They are more special than any other cell, I'm going to say. Maybe there are some exceptions, but they are more special than almost all other cells in the human body. And why is that? It's because neurons in the brain, for example, are permanent. You get one set of you get one type of neuron, and that neuron is supposed to last you your whole life. Your whole life. And once they die, for the most part, there are a few that might be able to be replaced through neuroplasticity and some stuff, but for the most part, once neurons die, they die. They're dead. They're gone. And that's why stroke victims have permanent deficits. That's why, you know, disorders like Parkinson's disease are so difficult to treat right now. Disorders like Alzheimer's disease, severe Alzheimer's disease, we often cannot reverse it. And why not? Because the neurons are dead. And it's not easy to get new neurons. Most of the other cells in the body, liver cells, heart cells, other muscle cells, kidney cells, uh, cells in your gonads, skin cells, they can all be replaced. They die all the time. They're constantly dying and turning over, and new ones are taking their place. And that's the pattern. So the reason it's, again, I'm just kind of going to this evolutionary speculation about, so why would brain cells be different? Brain cells are different because they cannot be bothered by the they cannot be bothered by the lack of glucose. You cannot. They basically have said, like, we are not going to become dead due to glucose not being able to get into the cell. So at the end of the day, it's really about glucose not being fully utilized by the cell. And almost always that ends up being due to mitochondrial dysfunction. When the mitochondria are dysfunctional, they are the ones that are supposed to be using the glucose, and then they can't use the glucose effectively.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
There is zero doubt in my mind, as a clinician who works with people with treatment-resistant mental illnesses, that ketogenic diets can be life-changing for some people. The very first signs of Parkinson's disease